Good afternoon, everyone. Welcome to the Health and Human Services Finance Division. We just came off the floor, which went a little bit long, so I assume that members are trying to grab some lunch and are going to be filtering in here. So we don't have a quorum, but we have important information to cover today. So we're going to get started in hopes that we have enough time, and we'll look for members to filter in as we go along. So. And we do have minutes, but we can't move them right now because we don't have a quorum. So we're going to have a presentation on the implementation of program integrity improvements and on children and family services. So if we could have our testifiers come up, please. Chuck Johnson. There he is. And Jeff Swanson, and so, okay, very good. So thank you very much for coming in today to give us an update, and welcome to the committee. Please introduce yourselves and however you want to make the presentation.
Thank you, Madam Chair. My name is Chuck Johnson. I serve as Deputy Commissioner at the Minnesota Department of Human Services. Thank you for having us here today, the opportunity to talk about this topic and the progress that we've made over the last year on improving the integrity of the Child Care Assistance Program. Child Care Assistance Program is a critically important program for working families across Minnesota. It's one of our few programs that actually serves dual goals of addressing early childhood by giving children an opportunity to be part of a program that can help them get ready for later life and for school, and also by supporting working parents. We all know how expensive childcare is and how important CCAP is to parents to get away from those hard decisions about whether to leave children in an unsafe situation or whether to have to cut down on work or work hours and put their family's future at risk. So we think it's an important program, and with any program like CCAP that has a budget the size of the Child Care Assistance Program, it's also really important to ensure strong integrity and oversight of the program. And that's what we've been doing over the last year, is working to strengthen the integrity and oversight of the Child Care Assistance Program, really on two fronts. First, a continuous improvement process that we implemented that focused on improving the practices and processes around how we do child care fraud investigations. And secondly, the implementation of the legislation that was passed last year, a real robust package of legislation and budget initiatives to help support us in this work. We'll start today by talking about the continuous improvement process and the new process we have in place for child care fraud investigations. Jeff Swanson is here with me. Jeff is the director of our Management Services Division, but also in this role leads our Office of Continuous Improvement as well. The DHS Office of Continuous Improvement not only has worked and continues to work on many issues in DHS, improving our internal processes, they were also the group that in 2018 went over to the Department of Health and worked with OHFC on the issues around elder abuse investigations and improving that process. This is an experienced group of people working on process improvement. So Jack's going to walk you through the continuous improvement process and what we've done there. As he goes through that, you'll actually hear him talk about some of the initiatives that you passed last year and how they're already being put into practice to help us improve the oversight and integrity of the Child Care Assistance Program. After Jeff is finished, I'll walk back through and go through a little bit more detail those proposals you passed and what the current status of implementation is to give you the full picture of what we've done. So I hope after the presentation, and we'll certainly take your questions, you'll have a good picture of the improvements that have happened over the last year. So with that, Madam Chair, I'd like to turn to Jeff Swanson.
All right, thank you. Welcome to the committee, Mr. Swanson.
Madam Chair, my name is Jeff Swanson. I am the Director of Human Services and the Director of the Office of Continuous Improvement. It is my pleasure to be here today and give you the good news that the Office of Continuous Improvement has seen over the last year of working on this project. And we'll kind of give you a walk down memory lane in regards to the old process, the legacy process, we refer to it, and then also the current process that's been underway around the last 6 months.
And Mr. Swanson, just hold the mic just a little bit closer.
Okay.
See if that.
How about that? Is that better? A little bit better?
Yeah, it's on. I think you just have a softer voice, I think.
I haven't been told that too many times, so I will definitely overcome that as much
Okay,
as I
and if I
can.
could just, since we're paused here for a second, we do have a quorum now. So could I entertain a motion to approve the minutes of February 18th, which is just yesterday? Representative Baker, thank you. If everyone's had a chance to review the minutes or remembers yesterday and take a look. And all those in favor, please say aye. Aye. Opposed, no. Motion prevails. Thank you. All right, please continue.
Thank you, Madam Chair. Members of the committee, back in December of 2018 through July 2019, the CCAP unit, the Office of Inspector General for the Department of Human Services, and the DHS Office of Continuous Improvement undertook a CI project to look at program integrity issues within the world of CCAP. We used a Lean Six Sigma is our cornerstone methodology for this process improvement project. We'll talk a little bit more about what that means. The Lean focuses on eliminating waste. You have two handouts in front of you. One is the before and one is the after. One's a legacy, one's a current. The legacy also has a list of 8 of the common wastes that are assigned to processes. And of those wastes that are there, 6 of the 8 wastes that we were able to identify was in the legacy process. And we'll go over those a little bit later, but that just shows you the amount of information we had, the blurred lines between the swim lanes, the lack of accountable data, other things that we'd be going into. We also,
Mr. Swanson, just to be clear,
Sure.
this really complicated chart is the old stuff,
correct, that's the legacy process.
and this easier-to-follow chart is the new stuff?
Correct.
Okay,
That means, that's why I'm with you today.
all right.
If it was the other way around, I'm not so sure, Madam Chair.
Well, I was worried about that. Thank you.
Sorry, thank you. So the lean process has just taken waste out of the swim lanes and out of the legacy process that we looked at. And then also the Six Sigma piece is reducing variations in the process. So you want to reduce the defects or the errors. So you focus on key performance metrics. So it's really a dual approach for continuous improvement in regards to this. Using Lean Six Sigma allows us for creating predictable and waste-free processes focused on measurable results. As you can see, we did our as-is mapping. This is a little bit more than a year old, but sitting down with members of the team, we were able to map out and visualize the process. There's a lot of power in doing that because sometimes in a lot of our programs, we've been around them so long, but we really haven't visualized the work. And when you see it up close and when you see the process, how it goes up and how it goes down and how it switches functions, it really paints a picture of what we do not only to ourselves, but to our customers and clients as well. We also did a observation of the work area and the work being done. We also heard loud and clear from the voice of the customer. Those customers are this body, the legislature, the OLA, DHS management, DHS staff as well. We listened to the hearings of last year. It was painful for us as it was for you guys to look at this process and try to get a handle on the data issues. Another thing we looked at was up and downstream validation. What did people need in the process? Not what were we producing, but what was really the needs of people upstream and downstream from the process. We ran into something that we call bureaucratic barnacles. They are just things that attach to bureaucratic systems and programs. When you have a few of them, they're kind of a nuisance. They're like mosquitoes. But when you get a lot of them, they actually drag down the program, and they can affect process efficiency and system efficiency as well. It's fair to say that, to my right, the legacy process that we encountered was a very target-rich environment for bureaucratic barnacles. Although the CI project started before the OLA report was published, the project findings aligned with the OLA recommendations. CI has compiled, their Office of Continuous Improvement has compiled a crosswalk, and we can make this available to this committee, that shows the findings of the OLA and then how the CI project actually remedied those. So we can make that available later as well. Some of those wastes that you see at the bottom of the swim lane that you have in front of you, the legacy process, like I said, 6 of the 8 predominant wastes that are in process improvement areas were identified. We also found that there was a major imbalance in the workflow. Think of it as teeter-totter. but with not equal people on the swing. So there was imbalance in the workload. That being said, there was also overburdening and grinding within the process, lack of communication between silos, really not a clear understanding of roles and responsibilities. So those are some of the things that our team encountered as we were looking at this process. There was really a lack of data, lack of meaningful data. That was some of the concerns we had. There was multiple repositories of data, everything from boxes to file drawers to C drives to home drives to shared drives to file folders in the corner of their office. So there was multiple areas. There was a manual data process. That's why whenever data requests were asked for last year, it was a scamper to try to go and find all the locations that might be to get that number. And that's why there were so many discrepancies when DHS was needed to give you guys a number. So we had a major issue with data that we had to address, and we started doing that right away after we did our discovery phase. The lack of repeatable data was so frustrating. We come up with a number on a Monday, and the same data sets, trying to get that number on Friday was almost impossible. That's because there was not those kind of policies and protocols in place that we'll be talking about in the new process as well. Lack of consistent prioritization of tips and cases, no standard tools for decisions. Criteria-based decision-making process was not repeatable. There was no criteria or protocols or weighted or measurements or metrics that could be put in place to duplicate a case and a similar case like it. Lack of overall process documentation, and then finally, lack of documented case outcomes in general. No repository for that information. In conclusion, with the legacy process or the as-is process, it predominantly drove the work and the focus on criminal convictions and did not effectively use the administrative tools available at the time. So the main focus was on criminal cases. Inefficient processes with cases taking 2 to 6 years to resolve. During those 2 to 6 years, funds were still being paid to providers while potential program integrity issues might be present. That forced our agency to get into a pay and chase model. Payments that were paid out, then we'd have to try to recover them, and the percentage of those recovery was not high. The process hindered productivity and efficiency within the unit, the 9-person investigative unit. The average investigator caseload was 1.5 cases in this system. The CCAP team is passionate about their work, but because of the process was bogged down with bureaucratic barnacles and inefficiencies, their productivity could not match their passion. Dr. Deming, one of the fathers of continuous improvement in North America, always indicated a bad process will beat a good person every time. This is a case for that.
Mr. Swanson, I just want to make sure I understand some of what you just said, because, you know, those of us who aren't like deep in system stuff, this is a lot of information.
Yep.
But I think that what you just said is that we had an emphasis on the criminal process that kept us from really getting control over payments. So you're not saying throw out the criminal process, you're just saying we didn't have a way to really stop payments from going out the door when we had concerns, and that they would be long gone by the time we could get our arms around what was happening. Is that kind of a good
Well
reason?
said, Madam
Okay.
Chair, members of the committee, that's exactly it. And that was the issue we had to remedy, and we will talk about that when we talk about our new process that
Okay,
was put in
please
place.
continue.
But that very much was a concern. We did not use those administrative tools that we had at the time effectively. The old adage is when all you have is a hammer, everything looks like a nail. That comes into play here. Any other questions about the as-is process?
Yeah, we could pause here and.
Sure.
Yeah, usually we keep questions till the end, but this is pretty complicated
Yep.
stuff, and I do want to make sure, at least clarifying
Yep.
questions. If members have just clarifying questions right now. Representative Baker?
Madam Chair, yeah, because we're on the old system now, and we want to pivot to the new system and where we're going, I think
Right.
it's maybe a question of, when you opened up the box to see what wasn't working, I guess I'm really curious as to how was the program, the CCAP employees, the department as a whole, how did they accept the what in the world are we doing here moment, or the siloed approach that you had brought up. Because again, I've seen other agencies, they get challenged. It's hard to break in new rules with old employees. I get it. How was the tempo of accepting responsibility honestly? How was that received? And I guess that to me was sort of like this moment of clarity sort of coming. But I really want to know, what was that base like when you kind of were laying this out as to what we could be doing better? I'm just curious about that.
Mr. Swanson.
Madam Chair, Representative, great question, thank you. During all these projects, I've been in the Office of Continuous Improvement, I founded it 10 years ago. Change is hard, everybody understands that, right? It's fair to say that this group, when we interacted with them, they had already been through the OLA coming in, talking to them. They'd already been through other people looking into their work. It's fair to say that there was a degree of defensiveness. We experience that in almost every project when we start out. We try to build trust with them. We understand with them that we're here to help you solve the problem. We're not here to say gotcha. That being said, it was a difficult, heavy lift for this project because everybody is at a different level of acceptance and understanding when you go through this process. Some people hold on to old processes, and it's hard to let them go. So in that regard, we had some of that. But after we got traction going, I would say 3-4 months into the project, we started seeing that momentum moving forward. And it's been a wonderful experience. Everybody's at a different level. They're getting their muscle memory down on how to do new work a new way. And remember, this process can be a major burden to people. That's why we talked about that imbalance and that overburdening. That affects employee engagement. It affects productivity, value in the organization. That's why that's why a bad process truly does beat a good person every time. Does that answer the question, sir? I want to be up front.
Yeah,
Very
okay,
quick.
Representative Baker, and then I think we'll just let
Yeah.
Mr. Swanson finish his presentation.
And my
Go
only
ahead.
comment to that is, because we've had the commissioner here before and talking about other seat reassignments and changes. And I hope, and maybe this is for later on, Mr. Johnson or whoever, I just hope that the agencies and the leadership have those abilities, because sometimes you hit some folks that really don't want to change. And I hope that those processes and employment adjustments, I'm not saying terminations, or I'm just saying it's good to move people around, and I hope we'll hear some of that as we go forward. That's all I really have.
Madam Chair,
Mr. Swanson.
Representative, part of this is finding the right work for the right person at the right time during the process. We will talk about more how we did that in the new process.
Okay, please continue. And members, if you do have clarifying questions, please raise your hand, but otherwise I think we'll let them get through. Okay.
Thank you, Madam Chair. Now I get the pleasure to talk about what we have implemented with the hard work of OIG and Department of Human Services and others. The time frame that we're looking at in regards to the current process is from July 2019 through January 2020. So I figured the last 6 to 7 months. We have launched and operationalized the new process, and we're continuing to make adjustments. The theme you're going to hear constantly as I go through this presentation is we don't rest on our laurels. We don't say, hey, we fixed this, it's okay, we'll just leave it and keep going. We are constantly looking at ways of improving our improvements, and we'll talk a little bit more about that. Again, we use Lean Six Sigma design. I hope that's as nerdy as I get in this presentation moving forward. But again, it's a methodology, it's a process that is proven, it's stress tested, it works. And the great thing about it is it helps us achieve sustainable changes, which is critical for the work that we need to do. We have put into place data transparency and data accuracy. You're going to be getting some of those numbers that I've met with some of you in meetings over the last couple of months, and I said we were going to have some good numbers for you, and we have those, and we'll be sharing those in this presentation. So data transparency, data accuracy is critical to us. Voice of the customer. What is critical to quality for you, for the administration, for our clients, for the taxpayers? What is critical to quality? That was in the formulation. That's what was in the design of the process that you're looking at. We also had the ability to do validation of this process. We brought in our coworkers and our fellow agencies from Department of Commerce, Department of Revenue, BCA, and also the FBI to validate this, to make sure it holds water, per se, and it represents best practices in a lot of areas. We also had to change our way of looking at information. One of my employees has, her famous phrase is, "Every day is data day." So that was our mantra in regards to moving on this project. For 7 months, that's been our focus. Every day is data day. We have to get a handle on data, not only for strategic purposes and explain our programs and results, but also for tactical programs, making sure people are accountable in regards to their actions and their processes. So that was a key part of it. Just like quality, data is a given. So that was going to be something that had to be part of this process so we could report the information in a timely manner to you. Now, on your handouts, I believe you have the new 2B process or the current process in front of you, and it should have some circles with numbers in them, 5 of them, I believe, correct? Right handout? Okay. So we're going to be focusing in area number 1, which is our intake and triage area. The primary entry point into this new process comes in 3 different areas. One is early and often, and Deputy Commissioner Johnson will be talking about that program and how your legislation last year has really affected that in a positive way. Data analysis, and of course, the OIG hotline for the general public to call in if they have tips or concerns. So those are the three ways that information comes in. We have received 57 tips and reports within the last 6 to 7 months. 57 of them have came through this triage, or this intake process. Intake leads to triage. This is a new team that was created. To your point, Representative, it gets to getting the right people in the right spot, correct? So the new team was brought in, dedicated for the triage function. They do further research and data collection on individual complaints. They use a documented, repeatable standard process to do this work. This allows for informed decisions as early as possible with as much information as possible. We're getting the information earlier in the process instead of later in the process. Now, this is where the math gets a little confusing because we have 63 investigations that have been opened during this time frame. Now, you might be saying, how did you get your master black belt if those numbers don't work, right? Well, it's this. 57 tips were created during this time frame, but there was tips that were initiated prior to July 1st when this took place, 6 of them. And those became investigations during this time frame. So there were 6 pre-July tips that, along with the 57, became the 63. Okay. So 63 investigations during this time frame. After triage, we have a process number 2, which is you see on your sheet is first assessment. This is a collaborative action made up of cross-functional teams from licensing, legal, data, and CCAP. They use a documented standard to review the data after the primary or the preliminary investigation has taken place. A comprehensive summary of data points from multiple DHS systems are reviewed for each center. We are breaking down the silos. So earlier in the legacy process, there was very little communication between divisions, believe it or not. Now we're breaking that information down. We're using data sets from different areas and helping to tell the story.
And
So for
Mr. Swanson, give us an example of that, if you have one up.
Sure.
Okay.
We had a situation where the licensing division would go out and make an observation, go out and do their licensing practices when they go out. And they would have some information that would come back. And because there was no central repository, how it got communicated, where it got communicated, was action taken, there was no way of really tracking that at that point. So it just became that multiple repositories, who has it, who's taken action when. Okay. Think of it as almost a one-dimensional and two-dimensional view we were looking at before. We are now getting to the point where we have a three-dimensional view of the issue. So it's not from one perspective of just CCAP. It's not just licensing. It's not legal. It's not data. It's all of them coming together to paint that 3D view. Based upon the facts and the data, decisions can be made to investigate further or to close or to take action. One of the actions they can take is based upon assessing for overpayments, referring internally or externally, or warning letters. DHS CCAP has issued 20 warning letters in the last 6 months. Warning letters are for minor policy violations, primarily on attendance records, things like that. These are I consider it like not that it ever happened to me, but if I accidentally get pulled over by a state patrolman and I get a warning ticket, or if I get a warning, that's a warning for my actions. So this is a warning that is based upon something that falls into what we consider a minor policy violation. Focusing on area number 3 of your swim lane in front of you, let's talk a little bit about the early and often and how this is a little bit unique to this new situation. If a decision is made to move forward from the first assessment to continue to investigate, we now have 2 investigative approaches where we only had 1 before. So we can leverage 2 different approaches. The first one is that early and often program, which Deputy Commissioner Johnson will be talking about a little bit later. That is a partnership made up of 1 licensor, 1 CCAP compliance monitor, going out as a pair. They go out to a facility together, and it's at that point where they can collect records, use firsthand knowledge to assess policy and licensing violations, as well as potential misconduct. It's doing that 1 visit, taking care of as many of the issues at that first interaction with the provider. So that's the first option we have, and the most desirable. The second one we have, if we have to leverage investigative skill sets from the investigators on more complex cases that require an in-depth investigation with various tools. So if we need to subpoena records, if we need to do video surveillance, if we need to do other investigative discussions with witnesses, then we can call in that aspect of the CCAP unit as well. So we have 2 approaches based upon how the team decides they need to go forward. Number 4 would be the second assessment. It's made up of a cross-functional team of subject matter experts from the Division of Licensing, Legal, Data, and CCAP. They are there to make data-informed decisions for how to proceed. Various administrative actions can be taken. These actions are not mutually exclusive. Multiple administrative actions can be taken at the same time. I'm going to give you a list of these as well. I shared this with the previous committee as well. Thanks to the action of this body and others, legislative changes granted in 2019 were instrumental in allowing DHS to take the following administrative actions as part of the current process. These are actions that would not have been able to take place under the old system. Approximately $600,000 has been assessed in potential overpayments for attendance records violations. $600,000. 2 CCAP registrations have been terminated per statute 245E. 2 CCAP registrations have been closed with payments suspended immediately because of evidence of intent to commit fraud under statute 119B. 4 administrative disqualifications have been issued to non-compliant providers. 2 of these are subject to or pending appeal. If we are not taking administrative actions ourselves, we can close the case with no further action. We can send a warning letter, as I indicated before, or we can refer internally to our licensing division or externally to our business partners in law enforcement. Currently, we have 12 cases that have been referred to the criminal investigation since implementing this process, 12 of them. We cannot comment on open cases, of course, as you know, but past data shows the majority of these cases do go to the BCA. We've also had 2 criminal convictions. One has resulted in the center closing itself. Finally, on number 5, the current process in place allows for increased caseloads and quicker turnaround for an investigation. This process does not sacrifice quality for speed. That was a concern at previous committee hearings in the fall. That's not the case. Quality is a given. It's integrated into the process. As my mom would say, it was baked in. In the legacy process, investigators had a 1.5 caseload that we talked about. In this new current process, we had a 450% increase in that. And the average caseload is 8.8 cases per investigators. And that's, just to be upfront on this, is usually when we implement a new process, we have a learning curve, so efficiency usually goes down. So to have these kind of improvements when we're actually in the middle of a learning curve is really remarkable. So a 450% increase is very nice. Like I said, we are constantly trying to improve our improvements. You will see on the right-hand side of that swim lane handout of the current process, see something we call PDSAs. It stands for Plan, Do, Study, Act. We are constantly improving the improvements as we go forward, making sure that we're tweaking this process and this program in such a way that we're accountable to all factors, taxpayers and for the program status as well. For those that are concerned about, hey, what if this happens again? Every part of the Six Sigma project really brings into place a control plan that affects for audits. It's a way of us to have key performance indicators. It focuses on measuring outcomes. So to rest assured, if something goes off the tracks, we will know about it much sooner in the process, and we'll be able to take appropriate actions to get it back on the tracks. This will be a responsibility for management within OIG to make sure they're working with staff and others to make sure that the process is followed. So for example, are we doing the process? If so, great. If not, why? And we can actually track caseloads, efficiency of the process, what's working well, what's not working well. That's all the byproduct of these audit plans or control plans. The OIG work units are living into the process. Change is hard, and it takes some muscle memory. There's a new appreciation for data. There's a new appreciation for process and standards. Everybody is at a little bit different level going into this and a little bit of different understanding, but we are confident that as a team, we will move together and continue to make improvements like we have day by day. I know this is so much information. I apologize. We're trying to get the balance of going either too deep or too high. So thank you for your patience. You want questions, Madam Chair?
Thank you, Mr. Swanson. I just have a real quick, so when you talk about, say, 12, I think you said 12 cases were referred now for criminal. What's the denominator? How many approximately, maybe Mr. Johnson knows, but like approximately how many entities are we overseeing that are potentially subject to this process? I just want to give us a sense of the scale, and maybe you can give us a sense, too, of how many employees are engaged in this process as well. Do we have even a ballpark on that, Mr. Johnson?
Madam Chair, I'm not sure I know the full denominator. So it's a number of licensed centers and plus the number of family child care. Most of the focus last year was on centers, but I know that we have identified several family child care. So I don't know if the criminal referrals have been on family child care, but several others have been acted on within some of the other processes Mr. Swanson talked about. I believe there's something in the range of 1,700 centers and something around 7,000 family child cares. So that would give you some perspective on the total universe. Those are ballpark numbers. I could get better numbers.
Sure, absolutely. And then how many employees, we know the department is I think our largest agency of state government, and how many people are now learning and working through this new process?
Madam Chair, so there's a couple of things. The CCAP fraud unit has, I believe, 12 staff in it. 12 staff, and then there's a manager, so maybe 13 total. But also, as Mr. Swanson said, we pulled licensing staff more into this team. So the early and often team that Mr. Swanson talked about is made up of both licensing staff and child care fraud investigators. We also have our OIG legal staff and our program staff involved in the decision-making processes. So at these assessment points, it's not just being made by one party, it's all those parties looking at the case together and making a decision on what the next best step is. So we have those perspectives in one room. That early often team in particular, that was where you provided us 10 FTEs last year into licensing. We combined that with 8 FTEs within the existing licensing group and pulling in a couple of investigators from the fraud team. That's the group that is really, I think, when we talk about improving oversight here, this isn't just about I think if you look at this model, a lot of what we were doing was kind of the pay and chase model. You know, it was we'd get a tip and we'd try to go figure out what was going on and often try to build then the big criminal case, which takes a long time and often the payments are continuing to go out while those investigations are being done. What we weren't doing very well, and that this process really builds on, both with the improvements that Mr. Swanson's team helped create, but also with the staff that you gave us and the tools you gave us, is to really get out ahead of those issues and identify. So that early and often team is going out to all new centers that open in their first 12 weeks. So we've identified before that new centers, first of all, setting aside fraud, generally new centers struggle sometimes with the licensing requirements, with the CCAP payment requirements. They just need some TA and some help. And so that team can be there to do that. But it also addresses the concern that we've heard often enough of, there's not even a child care program going on here. There's nothing, you know, we're out there with eyes on it in 12 weeks and we know whether or not there's a real program being run. And we can start to gather records if we have any suspicions of anything and move pretty quickly into some next steps on those. That team also identifies and makes extra visits on centers that may have a history of licensing violations, may have a history of irregularities in their child care reporting, child care CCAP billing and reporting. So we can keep more oversight of those centers where, or providers where we see some irregularities. So that's a really great tool just in providing that additional oversight. And then in addition, as Mr. Swanson said, this process continues to take tips, continues to make criminal referrals. We also have the oversight built in, and we also have the administrative tools built in, so that when we see something, we can act pretty quickly on a termination, collecting an overpayment, not necessarily having to build a criminal case, which is great when it works. But often enough, you can go through a lot of investigative work and realize you're not going to be able to sell this to a prosecutor, and then you're left back with having to start over, and you've spent all that money in the meantime. And I know part of our frustration, certainly in the agency, has been we don't want to keep spending money while these investigations are going. If we know there's something wrong, let's try to move to the quickest resolution, understanding that in some cases a criminal investigation is necessary because we need to hold people accountable. So it's balancing all of that, but it's actually putting those tools into a process that really uses them very effectively and very systematically.
Yep. Madam Chair, just to build on that,
Mr.
the only
Swanson.
tool we really had was that criminal tool in the legacy process. Now we have multiple tools based upon the severity of the situation to address it in a timely manner, an effective manner.
Great, well, thank you very much. Mr. Johnson, did you have more to say before we take questions, or is it okay if we?
Madam Chair, I can, the green side of this one-page handout we have has the legislative changes on it from last year. I can run through this quickly if it would be helpful to the committee, just to remind yourself of what the changes were.
Great, and then we'll turn to questions. Thank you.
So if you're looking at this document, you'll see in the middle there are 5 buckets. And as we talked about quite a bit last year, there isn't a single tool that you need in order to address program integrity. It really has to happen on multiple fronts. So provider record keeping and requirements, administrative sanctions, provider oversight, law enforcement, and data analytics are all part of where you enhanced our tools and where we've tried to leverage that over the last year and within this new process. So under the record keeping area, a lot of focus last year on trying to improve record keeping requirements. You'll recall issues around providers not being required to provide us records when we showed up immediately. Sometimes we'd get records that looked like attendance records may have been recreated after the fact, as opposed to they have to be there on demand when we show up now under the new rules. Things that were done with absent days and holiday billings, as well as decreases in enrollment that would be ways to try to manipulate whether a child was actually there on a given day. A story that we'd get when we asked them the first question, a story we'd hear when we got to the administrative hearing when they had records that were now relatively complete. And this helped to clarify all that and make stronger requirements around how that's done. And a uniform method for calculating overpayments, which is actually sounds like a pretty bureaucratic thing. Well, it is a pretty bureaucratic thing, but it was really important to have a single way so that we could streamline that calculation and have common agreement and not have challenges around how overpayments were being calculated. Within administrative sanctions, there was quite a bit of effort put here last year. This was both clarifying our authority for when we could terminate or suspend a provider based on violations of program rules. We also shortened the disqualification periods. The previous law had kind of a 3 strikes and you're out. First violation was a 1-year suspension, second year was 3 years, and then the third time was permanent. Now we have the first time is 3 years and the second time is a permanent disqualification from the CCAP program. And importantly, change the burden of proof. The burden of proof in most of our programs for administrative hearings around program violations is preponderance of evidence. But for some reason in the child care program it was clear and convincing evidence before last year. You changed that. That makes a standard that's much easier to meet in the administrative process so we can address issues quickly and get judicial support. Provider oversight, I already talked a little bit about this. This is the 10 FTEs you provide us around the early and often piece. This also was an area where there were recommendations both from a consultant that we hired and from the legislative auditor around looking at or moving toward electronic record keeping. Also looking at how we do registration of providers, which is currently done by counties and not centralized by the state. What you gave us last year to help with this was actually a FTE who has been working on the stakeholder engagement that's involved in these processes. We think that we need to consult a lot with providers, with counties and others, and we plan to come back to you in 2021 with some recommendations in this space about potentially moving to electronic record keeping requirements for some subset of child care providers. We also created new rules around ownership. We call them ownership provisions for licensing. And this was really to provide more information up front to our licensors about who really owns and who's responsible and accountable for running an organization, particularly in this case child care centers. And also to require that providers, when there was a change in ownership, actually had to get a new license. So we could actually go through the new ownership and understand who they were and not just have a transfer happen without visibility as to who those folks are. And obviously this is a way to identify people who may have been involved in other of our programs or elsewhere in the legal system and identify whether or not they're clean, pass a background study and all the things we need and we want out of the folks who are running our child care programs. Provided us with onto law enforcement, 2 additional BCA agents. Those are in the process of being put on board, and clarified a lot of data sharing that was kind of confusing within our program. Actually, it was not clear we could share data with law enforcement. We were doing it, but we were concerned it was a challengeable issue the way the law was written, so that was clarified. Sharing data with MDE that also runs early childhood programs, just things like that. And then finally, data analytics. You gave us funding for a case tracking system. We're in the process of putting that in place. We have a kind of temporary system in place that Mr. Swanson and his folks have been using to track data that's worked very well. We need to have a more robust case tracking system going forward, and we're in the process of investigating and getting an RFP out for that. And then also added additional staff for data analytics. Not just the output data that Jeff was talking about, but also using data on the input side. Using our data to help us identify where we're seeing patterns or problems to be able to identify and make our own referrals based on what we're seeing in the data, not waiting for someone else to come and say, hey, I see a problem in this place. So that's just a very, very quick run through of the legislative proposals from last year. A very robust package of tools that you put in place.
Great, and you have there's a whole other side to this piece of paper also. And did you want to go through any of that, or you kind of have for some of it?
Madam Chair, that's mostly a summary of what Mr. Swanson talked about.
Okay, all right, thank you. So I think we're ready to go to questions then. So I have Munson, Grunhagen, and Bierman on the list. So Representative Munson.
Thank you, Madam Chair. And thank you very much for the presentation today. I live and breathe swim lanes and value stream mapping in my day job, so I'm right at home. I can see the decision points from across the room. Can't read the detail in here, so I'd like to get a Visio copy or somebody wants to email me one. I'm very much an agent of change in my day job, and I'd love to be one at the legislature, but I understand government has more of a resistance to change than the private sector. And so I don't envy you in trying to put in some major changes in this program, because I'm sure there's a lot of major resistance to change, especially. But I'm thankful for the work you're doing I know that we're going to maybe disagree on how much for fraud there is in CCAP, and I don't want to rehash that, but, it's probably going to be 6 million versus hundreds of million on this side of the table that we think that there is in place in the CCAP program. The Appendix B of the OLA report, I could probably recite it verbatim. I think I put my kids to bed at night with it. I've read it a million times, and it's really concerning on how much potential fraud there could be in the program. So my just two questions. One is just, do you believe that there could potentially be that much fraud, where it'd be over 50% of fraud in the CCAP program? And then as you're going through the value stream mapping and finding potential changes that would make things more efficient for the program, prevent more fraud, waste, and abuse, do you run into conflict with federal law or how the federal program is constructed that that we're required to do things a certain way and we can't change it? And could you speak to those points?
So would that be Mr. Johnson?
Madam Chair, I can start with the first half of the
Okay.
question and maybe take a shot at the second half and see if Jeff has anything to add. As far as the extent of fraud and Appendix B of the OLA audit, no, I don't believe that that's a fair characterization of the extent of fraud in the program. I think that part of what having this process in place for a while will help us get a better arms around is sort of what we do think the extent is and a better measurement of it instead of kind of a shooting in the dark. I would just say, to that, as far as, part of how I look at it is that in that memo that was attached there, Mr. Swanson, a different Mr. Swanson, had identified 100 centers that the CCAT fraud investigators had concerns about. And, so first of all, in the last year, every single one of those centers has been visited. Many of them closed since that list was put together. And so if the fraud were as obvious and extreme as you think it was, I don't think our licensors would have walked away from that center and allowed it to stay open. Even at the time last year when the conversation was happening, we had eyes on almost all those centers within the last year. There were a few we hadn't gotten to yet. So that leads me to be concerned about exactly what, and that goes kind of what Mr. Swanson was talking about earlier is, how do you identify what a suspicious center is? How do you get that information? And where I think the use of data has to be part of how we're doing that and not just based on hunches and assumptions. And so I don't think that it's that as egregious as was suggested there. It is obviously a serious concern, and we wouldn't be doing what we're doing here if we didn't think that it was. But I think what's really important is trying to get ahead of that curve and trying to identify it as early as possible so that any center that is running some kind of a scam isn't allowed to do it for very long before we shut them down. On the second half of the question, there may be some federal rules as we get into how billing and paying and some of the eligibility pieces work that we're going to bring back next year. I don't know that offhand that that's necessarily a problem. We tend to be pretty good, and this might be something that Mr. Swanson could talk to, at figuring out how we work through those. They're not things we can change. We just have to make the process work the best it can, given the givens. And I don't see that as being a major issue, what we've gone through in the last year, but it could be as we get into some of the more control stuff on the CCAP program side.
Okay,
Correct. For
Mr.
further
Swan.
follow-up, we did not run into that obstacle on this project in regards to federal requirements or processes. They have come up in other projects that we've worked on. And to Chuck's point, to Deputy Commissioner Johnson's point, we are able to pivot on those rather quickly and come up with a workaround that's compatible to the federal requirements as well as our state needs.
And
All right.
Chair, just a quick question.
Representative Munson.
I'm not really, I guess I want to ask my question a different way. There's a federal requirement that we visit every center in the state once a year. Just an unannounced visit, just pop in. Are they even legitimate there? Do they have kids there? Are they, stripping auto part car, whatever they're, are they in business? Have you done that to every center last year, or are you on track to do it this year? Or are we going to have to ask for another exemption? Because I don't think we've complied with the federal law at all in the last 4 or 5 years.
Mr. Johnson?
Madam Chair and Representative Munson, yes, we did in the last year. It was the first year. It was consistent with the plan we had. I believe it was 2017. The legislature provided us with 40-some FTEs for licensing to expand our licensing pool, and those folks are now all hired and on board, and we hit every center last year.
Thank you.
All right. Representative Grunhagen.
Thank you, Madam Chair. Yeah, thanks for the testimony. Yeah, it seems like an impressive list of changes. to try to address some of the concerns, regardless of what the dollar amount is. But my question is, are other states that are addressing this using similar processes, or did we reinvent the wheel ourselves? Or, you know, obviously there's 50 states that deal with this, and some of them must do a better job than others. Are some of the things we passed got a proven track record of, you know, reducing fraud in the system?
Mr. Johnson?
Mr. Chair and Representative Gruenhagen, I think that I'm not sure how much we've benchmarked against other states. I could follow up with staff to see how much we've talked to other states around some of the particular issues here. I think these were addressed many of the issues that the legislative auditor raised in their audit around challenges that they saw and things where they felt like the controls needed to be tighter. I do know the piece of trying to provide better oversight and get to centers earlier and get to fraudulent centers earlier and to make better use of administrative tools is something that other states have used more effectively than we have. So picking that up and really highlighting that set of tools definitely puts us more in line with where other states have been in addressing child care fraud.
Okay, Representative Bierman.
Thank you, Madam Chair. Representative Munson, did you say a place where they were stripping autos? Is that what I heard? I just was wondering if that's a career technical child care facility.
Making sure that it's not an auto parts place or
Okay,
something to.
I got it. All right.
Bierman.
Sorry, Madam Chair.
Thank you for that clarification.
Thank you, and thank you for being here and taking the questions today. Mine are regarding the tips. I'm just curious where most of the tips come from. It seems if the county is running these programs and the data is all going to the county, do most of those tips come through the county offices to you? And they have the records as far as, so could you just comment a bit on where the tips are coming from?
Madam Chair, I believe we have a breakdown of the tips, and we can probably get that to you. I can tell you generally counties are a pretty big source, parents, general public. So counties, I think, and parents are the major source that we get our tips from. Sometimes law enforcement will tip us too, which is maybe seen a little bit reverse, but they will sometimes want to bring us in when they see something they think is suspicious, so that's another source. And I'm pretty sure we have a breakdown of that I could get to you.
Okay, and then just to follow up to that, as far as the county reporting, the child care centers, as I understand in my district, they are required to use paper for 3 years. Does that sound correct to you? That's what I'm hearing, rather than electronic.
Mr. Johnson?
Madam Chair and Representative Bierman, I have not heard that.
You have not heard that?
No. I could follow up. I don't know if that's a particular.
If you
county
would,
requirement.
I would appreciate it. I actually have a child care center who is talking to me about that. And the information I've gotten back so far is that they have to go 6 more months before they can switch to electronic. So I'm very interested if you could. That would be very helpful to me, please. Just one more question, please, Madam Chair. And this is in regards to the numbers, the caseload, going back to the caseload, the 8.9. Which is an impressive jump over the 1.5. So one thing I'm wondering is with the increased attention to the child care facilities, you know, I compare it to maybe to the retirement communities, the nursing homes, when there were changes in the program, there were more things that were reported, even self-reported by retirement homes, and that helped to increase the curve of the complaints, which really drew more attention to the nursing homes. And I'm just wondering if that plays into this, if you're looking at different things, reporting the process differently, if that's part of the increase, or is it an increase in valid cases that you need to assign to inspectors? Could you comment on that?
Mr. Johnson?
Madam Chair, Representative Bierman, I think that it is possible there's some effect. Anytime something is in the news, certainly, we start to then see more volume of it. And so I think there may be some factor there from the last couple of years of attention around child care fraud, of people being more conscious of it. Certainly, I think our county partners are more conscious of it than they probably were 3 years ago. And that may increase. I would say that, you know, and Mr. Swanson didn't say this is direct, I'm going to say it, but one of the things that's challenging for us is talking about trends here, because we have pretty good data from July 1 of last year when this process got into place and we started tracking things. We just don't have good enough data from that prior period to be able to say, is this an increase or a decrease, or we have some suppositions based on the data we have, but the data was so difficult to validate that it's really hard for us to say whether we're seeing an increase or a decrease in tips relative to what we got before.
One last question, please, Madam Chair.
quick,
Real quick,
we
just,
have-
I assume that we'll get more data on investigations or results as you presented already going forward. Thank you.
Correct.
Okay, so we have another presentation as well, and so we only have like 12 minutes left for this one. So I have 5 members on the list, so we're going to try to be concise if we can, please. Representative Moran.
Thank you, Chair Liebling. So I just want to remind everyone that the Child Care Assistance Program is serving like over 30,000 children. And you do that so that parents can go to school or go to work. And 60% of those children are under the age of 5. So the program has been utilized, it's needed, and really provide the support that parents need to go to work, but also ensure that children are in a safe, nurturing environment while they do that. So it's a critical program. I have, and I'm really happy that we was able to put these integrity program into place just to be more accountable, you know, because there's a big difference between making sure that the program is functional than not having a program around to serve these families. So I'm glad that we can see a plan in place that's working. My question is, you talked about, you know, at one point that when there was a non-compliance with a provider, that you continued to, there was continued payment that was received by those providers while you worked through the cases. But now there's a stop payment immediately. And I think a lot of things when I think about that, you know, whether or not the charges of noncompliance are true, or maybe some biases are there, or things like that that may show up. So what creates is it only for criminal case that non-payment stops? And what is a criminal case? What does that look like?
Mr. Johnson.
Madam Chair, Representative Moran. The challenge with the criminal case is you have to be able to prove intent. So there has to be some fairly obvious activity going on that couldn't be a mistake or an oversight or just a challenge of managing the volume of billing work that is pretty complicated for a child care provider to have to do. What we commonly see is that it's not unusual for a provider to have some irregularities in their attendance tracking and billing because of the complication of doing it. And as Mr. Swanson said, we use warning letters as a way. If we see something that looks like it was not being done correctly, we will not immediately take the action of shutting them down or disqualifying them if it seems like it was a reasonably just a mistake that may have been made. But we will send a warning letter to make it clear to them that, you know, we have attention on this and we need to see improvement in what they're doing. And then a subsequent action might well be that they would be terminated, or there might be a overpayment taken back, which is another action that we can take. If the initial thing we see is very egregious and seems like it's obvious or at least a huge concern that they may be committing fraud or billing a lot of money for things that they have no clear attendance records, that might be where we would jump right to doing some kind of a disqualification. There is a judgment point as to whether we take an administrative action and do a disqualification or pursue an overpayment versus make a referral to the BCA or another law enforcement to actually take the case criminal. And that's where we're looking at whether or not we think that behavior is so egregious that it's possible that a criminal case could be put together. That then goes to, you know, again, usually the BCA, but it could be other law enforcement to make that assessment. They might refer it back to us and say, we don't think this is probably criminal. We might then take one of the more significant administrative actions like disqualifying them from the program. So there's a lot of judgment that has to go into that. And I think the intent and the understanding of what we're trying to do is to have eyes on centers early on. So if there's some challenges, we can help to correct that as opposed to just immediately jumping to some kind of a termination or something that would affect their ability to provide care to kids. But there has to be a judgment that goes into that. And the criminal thing in particular has to be pretty egregious for us to say, we really think, someone from law enforcement needs to look at this and make an evaluation.
Thank you.
Okay,
One
thank
other
you.
question.
Sure, Representative Moran.
Thank you for this work. It seems like it's a lot invested in it. I'm glad we was able to give you the dollars to be able to hire more folks so that we can be accountable. But we have still some more work to do. So right now, we are in violation with the federal law around the 25 percentile rate for providers who do a good service for us, but the reimbursement is so low that many have decided that it's not even worth it. So are you making some type of recommendations to us to say, or maybe it's the other committee, right, that we come into compliance? Because are we still in violation and now we owe the federal government money?
Mr. Johnson.
Madam Chair and Representative Moran, I think that Acting Assistant Commissioner Bailey is probably going to talk a little bit more about this in the next presentation. But yes, we are. We still have not met the test from the 2014 Child Care Block Grant regulations for our rates in child care assistance program. And I expect that you'll see that recommendation coming from the governor again for, I believe, it'll be the fourth time in a governor's budget to try to raise the child care rates.
Well, I just hope we can do what's right for providers and give them that increase. Thank you.
Thank you, Representative Moran. And I just want to thank Representative Moran for really being a champion on this issue. In conference committee, she carried a lot of the load on getting a lot of these things done. So thank you very much for that. Representative Schumacher.
Thank you, Madam Chair. And Commissioner Johnson, in the omnibus bill last year, there were savings banked for the program integrity improvements. It looks like about $3 million for this biennium with that. With these improvements there, have you started to see some of the savings that were banked for that? Or I don't know what the assumptions were for those savings, but could you tell us about how that's coming along?
Mr. Johnson.
Madam Chair and Representative Schumacher, I believe the savings that were in the program integrity area in the bill last year were not associated with these changes, but associated with adding more staff to our area that does Medicaid program integrity investigations and adding more money to the fraud prevention initiative, which funds county investigators. The business of booking savings on program integrity is very complicated because we need to be able to show that we have a history where we can demonstrate that putting in additional money your staff actually brings back more money. We weren't able to meet that test with the child care area, so we weren't able to convince MMB and the others needed that we could actually book savings on it. I hope that with this kind of work in place, this kind of tracking going forward, we'd be able to make that case if it came to a point where we thought we needed to make some additional investments.
Representative Schumacher, thank you. Representative Baker.
Thank you. And like many members here, I think I'm cautiously optimistic of the work that you've done. I know that the taxpayers have invested heavily into this, and what you've shared with us today is exciting. And we are cautiously hoping for very good results. So thank you for this. On your number 2 point, Mr. Swanson, when you were talking about the assessment teams, and you mentioned there's like 20 warning letters that went out for minor violations, I think is what you maybe said. I'm curious about the issues we hear from home daycare centers and even centers themselves, but some of the public shaming that happens with minor violations or other violations. Have you changed the way that is done now, like online? And maybe it isn't your purview to do that, and if it isn't, I apologize. I'm curious about some of those listing of some minor violations that can hurt businesses, and sometimes we are hearing folks want to just get out of the business because my home is not perfect. And any thoughts on that, quick?
Yeah, and Representative Baker, and they can comment, but I think you are confusing two different areas because they're talking about the financial piece, and I think what you're talking about is more licensing.
Yep.
issues about,
Okay.
yeah, and I think that would be a different, division, I believe.
Madam
that's fine.
Johnson?
Madam Chair, that's correct. I think you're probably talking about Fix-A-Ticket and some other pieces that have been put in place on the family child care side. And there's a task force now working on family child care chaired by Senator Kiffmeyer and Representative Wozlowick. So they're working on some of those issues. And we could certainly get you some information on the Fix-A-Ticket and how that's worked so far.
Thank you, thank you.
Thank you, Representative Baker. Representative Franson?
Thank you, Madam Chair. And I have a series of questions, and I know there's time. So if it would be appropriate, if I don't get them, if I could just email, would that be okay?
That'd be great.
Mr. Swanson, I think I heard about $600,000 established in overpayments. Could you say what is the average provider overpayment amount? And then how are the CCAP overpayments being calculated?
Yeah, Mr. Swanson?
Madam Chair, Representative Franson, I do not have that data currently. I can go back to our data team, and we can request that information.
Okay,
And
awesome.
if you could share that with the whole committee.
Sure,
that would-
definitely,
In fact, if you
definitely,
could
Chair.
send it to Mr. McQuillan, he can circulate.
Perfect.
that.
We'll go through our team on that as well.
Thank you.
Thank you.
Representative Franson?
Thank you, Madam Chair. And then who is responsible for collecting the overpayments? Is it the state or is it the county? And I know you don't know how much has been up to date, but we'll get that number later, I
Yeah.
guess.
Mr. Swanson? Or Mr.
Madam Chair and Representative Franson, I believe that the state actually collects the overpayment. We issue the overpayment letter, but that is different within some of our programs. But I think on the provider side, we're usually the ones who collect it, so I expect we would be in this case.
Representative Franson?
Thank you, Madam Chair. And then are those claims being entered into the MEC squared? They are being entered there?
That
Okay.
is correct.
All right.
Madam Chair, if I could clarify too, that 600,000 is identified and in process right now. So most of it, maybe all of it, I'm not sure the exact status as of today, has not yet been billed, but it is in process of being billed.
And then final.
Okay, finally,
Final. Thank you,
Representative Franson.
Madam Chair, for indulging me. What collection practices are used then to collect those taxpayer dollars back? Is it garnishment, levies?
Madam Chair and Representative Franson, garnishment or reduction in future payments is a normal way that we would do a collection. So if this is a provider who hasn't been shut down, we're continuing to pay them, we would just collect it back out of their future payments. But they could pay us straight up to, we do when we don't get payment, go to other collection mechanisms like, continuing to bother them with letters, trying to use the tax system through the Department of Revenue. We do that across all of our programs.
Okay. All right.
Right.
Thank you.
Thank you, Representative Franson. Finally, Representative Noor.
Thank you, Madam Chair. Thank you, Deputy Commissioner. My quick question is, what is the rate of errors coming from the agency, participant, or the provider? How do we differentiate the errors that create overpayment based on agency errors, not taking action on time, or participant creating the error? The other question I think Representative Beeman was asking about is, we have MEC Square Pro, which allows the centers or childcare entities to send billing. And how many counties are using that? And why are we not using electronic process of allowing the counties to do billing? So why are we using paper format when we have electronic format that reduces the type of errors and you can always go back to the electronic system?
Mr. Johnson, there's a lot there.
Madam Chair and Representative Noor, I'm not familiar enough with those processes to answer your question, so we could follow up on that. I do think the questions about using electronic process and using MEC Squared Pro and county differences might be something that's in Representative Bierman's questions too that we can follow up on.
Thank you so much.
Thank you, Representative Noor. And, just before we end, I have a question too, which you could answer offline, I think. I mean, send maybe some response either to me or to the whole committee. But I'm interested in how are we assuring in this new system that we're reducing disparities or at least not creating more disparities? Because there's been, we've had an issue with that. So on the, allegations of fraud and then allegations that we're targeting certain communities. And so I liked what I heard about there are, more objective criteria. I think maybe that's part of the answer, but I also heard that there is subjectivity in this. So I'm interested in how we're assuring that the rules are applied fairly across the board. And I know there are efforts to assist childcare providers, not just do a gotcha. I've heard that, and that's really good news, because we know that a lot of people, they're doing it because they love the work, not because they're fiscal experts, right? But I think we all need assurance that there is, as we move forward, that we're getting good program integrity, but we're not targeting any communities, and people have assurance that the rules are the same for everyone. So thank you very much for your presentation today. We really
Thank you, Madam
appreciate
Chair.
it.
Thank you, Madam Chair.
I'm going to call up Lisa Bayley. Sorry to cut into your time here. Welcome to the committee. And please go ahead and introduce yourself.
Thank you, Madam Chair. My name is Lisa Bayley. Excuse me. I'm the Acting Assistant Commissioner for Children and Family Services at the Department of Human Services. And thank you for this opportunity to come today and talk briefly now about what's going on in Children and Family Services. What I'm going to do, just given our time restraints, you have a packet in front of you that contains some key statistics on each of our departments, each of our divisions, and then has some descriptions of what's gone on this last year, and then talks about what we'll be doing going forward. And so I'm really going to focus on what we're doing now and what we'll be doing going forward, but I'm certainly happy to take questions. Children and Family Services is comprised of several large divisions. So I'm going to start with Child Care Services, since we just heard about that. In our area is the program area of Child Care Services, where we're actually administering the program. And so in the last year, obviously, we've been working closely with OIG, as you just heard, on a lot of the program integrity work. But we've also been working on the program improvements for federal conformity, things that this body approved last year. And I won't go into all of the details on these, but they have a lot to do with ensuring sort of a seamless opportunity for the provision of CCAP and eliminating a few of the, or rather installing a few of the program integrity issues, such as reducing the 6-month limit. I'm sorry, reducing the 6-month look back time to 3 months. We're also then, as far as implementing this year, what we're doing is ensuring some of the new policies that are being rolled out, implementing, again, that retroactive eligibility period. We're doing a lot of stakeholder engagement, working with community members, providers, parents, making sure they know what's going on, but also finding out what the issues are and problems. One of the significant areas I do want to address is that we're looking at the addressing homelessness, and on several different areas, ensuring that families who are experiencing homelessness are not unfairly targeted and they're still able to receive those services. In terms of ongoing work, Mr. Johnson just talked about that 25% CCAP rate increase. That's something that the federal government is required. Again, we'll be coming back, I believe this year for the 4th time to ask about this. And this is talking about the CCAP maximum rates, which must be at least in the 25th percentile of the most recent market rate survey, which is 2018. Okay. And in addition, this year, in terms of health and safety licensing, among sort of other issues, some minor issues, such as making sure that military programs are included in the CCAP program. We're also looking at a language change in terms of licensing that substitutes who are working at a child care center must also take health and safety training. And then finally, that's all on the CCAP side. On the child care services side, this is the side that provides grants for child care providers, training, and works on the grants for programs that are participating in Parent Aware. Really, we've found that many of those grant programs are quite complex. They're difficult to apply for, and we're working on simplifying those, and that will be something that that will be addressed this year, we hope. Moving to the Child Safety and Permanency Division, just real quick, last year we had about just under 40,000 children were screened in for child maltreatment reports, which is a 50% increase since 2014. And while we saw a slight reduction in 2018 of the number of children who actually entered out-of-home placement, which we're very pleased about, that's the first time that's happened since 2010. We still have large numbers of children in foster care, and the time that they're spending in care has gone up. So we've done several things in the last year, thanks to this body and the approvals you gave us this last year. Child Welfare Training Academy is well on its way. That's going to have a 4-year rollout period, but we've done a lot of work already. The curriculum is in place. The actual facility is almost complete, and then that we'll be accepting students starting in the fall, and then that will continue going on this year and for the next several years. 2 of the tribal expansion, the initiative tribes have been added to, let me rephrase that. 2 tribes have been added to the initiative program. That is the Red Lake Nation, which will become the 3rd tribe to join the initiative, and Mille Lacs Band of Ojibwe, which will this year be in a sort of a planning phase. So we anticipate that Mille Lacs will come online probably in about 2 to 3 years. It's quite a process. But Red Lake Nation is well on its way, and we anticipate that that's supposed to be all of the child welfare duties should be transferred to Red Lake Nation in January of 2021. Also in child safety and permanency, we've done the initial work to get the Family First Preservation Services Act in place. That's the federal act that made some fairly significant changes to the Title 4E of the Social Services Act that reimburses counties for foster care. It also now has some pretty serious restrictions on that foster care, that reimbursement, and you're going to probably hear about that this year. We are coming before you to ask for some fairly significant changes in the Qualified Residential Treatment Program policy, the QRTP. You'll undoubtedly be hearing about that. Those are the changes that we'll be requesting are to bring us into line with the federal requirements for this. The Family First Prevention Services Act doesn't actually go fully into effect until the summer of 2021, but in order to get us prepared to do that, we need to make these changes now so that we can then also bring the facilities to get their capability and capacity up so that they can draw down those monies. Also in the summer of 2021, the good piece of the Family First Act is that there will be prevention monies that will be available, a 50% reimbursement for those things. And so we're working on coming up with what that service array should look like. We've done a fairly significant and large-scale community engagement process, and that will be continuing on all of this next year so that we can get that fully into play. So the Family First Prevention Services Act is probably something you'll be hearing more about. Also in child safety and permanency, we're working on ICWA and MIFPA compliance. As everyone knows, the ICWA is the federal law which protects the best interests of Indian children in promoting the stability of and the rights of Indian tribes and families. It's something that we're working on improving the compliance of counties with that law, and we are providing fairly significant technical assistance to counties and to tribes to assist with compliance in that area. That's something that has improved just over the last 2 to 3 years. Just this last summer, we did our first full-scale analysis of all the counties. We found that compliance with that act was about 62%, which is obviously not acceptable. And so we found that the counties very much want to comply with that and are working closely with us on receiving that technical assistance. But it's a complex law, and it's something that's going to take some time to come into full compliance, and something that we're expecting and really pushing for. In our economic supports, I'm sorry, I didn't mention, probably the biggest issue that we talk about on a daily basis in child safety and permanency is the disproportionalities, the children who are overrepresented in our child welfare system. And that's African American children are disproportionately represented at a rate of 2.3 times more likely to be involved in a report of maltreatment, 2.9 times more likely to be involved in a maltreatment investigation, and 2.9 times more likely to experience out-of-home care. Now, I talked about what we're doing in terms of the Native American children who are even more disproportionately represented in our child welfare system. In terms of the African American children, we're looking at this last year, we've been working with community members, providers, with counties on developing an array of potential proposals to address this disparity. And it's something we are very much committed to working on this year and hopefully being able to come back before you with some of those ideas. In our Economic Assistance and Employment Supports Division, this is the area that handles SNAP payments, MFIP, and things that this body is very familiar with. First, we would just want to again say thank you to this body for approving the $100 a month increase. That went into effect on February 1st, I believe it was. That went live. That was a fairly significant thing internally to get ready for that from the systems-wide and notice-wide. But that went well, and that is thus far, it's on its way and something that we certainly appreciate very much. In terms of SNAP, there's a great deal of sort of simplification things that we're working on and we're looking at exploring best practices and technical assistance to counties to reduce the error rate on the SNAP payments. That's something that we need to we're just above the national average, and we need to get that number down. And so we're working with counties on that fairly significantly. Also in economic assistance in that area, we're working on, in part as a result of the work of the legislature encouraging us to continuing to look at program simplification and trying to reducing errors in eligibility and people who are having to go to multiple places to apply for benefits. So we're looking at several different options and ways to simplify applying for benefits, going sort of one-stop shops. There are a lot of issues related to information sharing and that kind of thing. So those are things that are taking a while to get in place, but it's certainly something that's actively being pursued. So I know that was just kind of a high-level, super fast version of things, but I'm open for questions, and there are other issues I can address, and I have some staff here who could address things as well.
All right, well, thank you very much for that. You certainly covered a lot in a short period of time, and we appreciate that. Sorry again about cutting into your presentation time here. Are there, we can go a few more minutes if members have questions. I'm not seeing any right now. Representative Noor?
Thank you, Madam Chair. One quick question, Assistant Commissioner. What is our work participation rate for the TANF program? And also, how are we coordinating the workforce development employment process with DEED in terms of coordinating the two agencies to make sure that we have a good outcome for participants in the system?
Assistant Commissioner.
Madam Chair, Representative Noor, I don't have that answer right here, but we can certainly get that information for you.
Okay, thank you. Okay, I'm not seeing any others. I'm going to grab you as soon as we finish here because I want to talk to you offline about something for a moment. And any other questions from members? Seeing none, thank you very much for your presentation. We are adjourned.